again. I'm Naila Zahra Iman from Nursing Faculty of Andalas University. So in this video, I would like to share about nursing assessment, and I would like to persuade you to not be afraid to do nursing assessment at the hospital. So let's get started. So, nursing assessment is the gathering of information about a patient's physiological, psychological, sociological, and spiritual status by a licensed registered nurse. In some instances, nursing assessment is very broad in space, and in other cases, it may focus on one body system or mental health. Before assessment can begin, the nurse must establish a professional and therapeutic mode of communication. This will assure that the patient will be as comfortable as possible when revealing personal information. A common method of initiating therapeutic communication by the nurse is to have the nurse introduce himself or herself. So in this opportunity, I would like to share about nursing assessment with A, B, C, D, and E method. So, do you curious what ABCDE is? So yeah, ABCDE is airway, breathing, circulating, disability, and exposure. The ABCDE approach is intended as a rapid bedside assessment of a deteriorating or critically ill patient, and it is designed to provide the initial management of life-threatening condition in order of priority. Using a structured method to keep the patient alive and to archive the first steps to improvement rather than making definitive diagnosis. So, first thing first is airway. Yes, airway is the most important part of patients to assess. If they don't have airway, this is saying you're going to observe the airway. If possible, do a head tilt chin lift and open the mouth and have a look if there is something occluding their airway. At this point, look, listen, and feel. Look for the chest movement, listen for the air entry, and feel for the chest rising and falling. If you have established that the airway is okay, you can go on the second step, breathing. Assessment of breathing is designed to detect signs of respiratory distress. A general sign of respiratory distress, such as sweating, the effort needed to breathe, abdominal breathing, and central cyanosis. The respiratory rate should be measured by counting the number of breaths that the patient takes over 1 minute through observing the rise and fall of the chest. Assess the depth of each breath the patient takes, the rhythm of breathing, and whether chest movement is equal on both sides. Next is considers patient circulation by assess the patient's heart rate. Heart rate is usually felt by palpating the pulse from an artery that lies near the surface of the skin, such as the radial artery in the wrist. Now we're going to move on to this section, which is loosely called disability. These assessments involve reviewing the patient's neurological status by using the AVPU system. First is awake. Observe the patients if they can open their eyes, take interest, and respond normally to the environment. This can be assessed as awake. Second is responding to voice. If the patient closes their eyes and only opens when spoken to, this would be assessed as voice. Third is responding to pain. The patient who doesn't respond to voice should be shaken gently to try to elicit response. If there is still no response, then painful stimuli should be applied. The last is unresponsive. That means that the patient responds to pain. So our last stage is E, which is exposure. Should be a good understanding of the patient's problem. Last thing is to always seek from more senior if the patient is continuing to deteriorate. So that's all about my explanation about nursing assessment. I hope we can do nursing assessment because it can detect signs or any symptom earlier. That's all from me. Thank you.